Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today we're going to study the fibrous and cartilaginous joints. So, we'll also study their subtypes. These are all the questions which are so commonly asked on these topics. What are fibrous joints, write a note on cartilaginous joint and so on. So, let's talk about these by first understanding what is a joint. When two or more bones meet, they form a joint. Either the ends will meet, or the surfaces will meet, or the margins will meet. Very simple. Okay. Depending upon their function, you can classify joints into immobile joints, which don't move, synarthrosis. Little bit mobile joints, amphiarthrosis. Very mobile joints, diarthrosis. But have you ever talked with any doctor saying, this is an amphiarthrosis? Doesn't happen, no? Because these are not terms we use that often. But unfortunately, they get used in MCQs. So you must know what is synarthrosis, what is amphiarthrosis, what is diarthrosis. This is an MCQ, I'm sure you can solve it. Depending upon structure, you have one more classification. This is dependent upon the tissue that lies between the two bones. It can be fibrous, it can be cartilaginous, it can be a cavity. So accordingly, when the tissue between two bones is fibrous, you call it a fibrous joint. Tissue between two articulating bones is a cartilage, you call it cartilaginous joint. And when between the two bones there is a cavity, synovial cavity, you call it a synovial joint. Take a look at these images to understand. Fibrous tissue between two bones, which joint? Fibrous joint. Cartilage between two bones, cartilaginous joint. Cavity between two bones, synovial joint. Today, we are studying the fibrous and cartilaginous joint. Synovial joint is covered in another lecture in the form of typical synovial joint and types of synovial joints. There are two lectures. The description section is giving you the links. Please do go and see those lectures as well. So, let's now begin today's lecture, which is fibrous joint. Joints are held together by bones are held together by fibrous connective tissue. Very simple. Okay. These are further subclassified into sutures, syndesmosis and gomphosis. What are they? Sutures, syndesmosis and gomphosis. Basis, two bones held together by fibrous tissue. Right. So let's talk about sutures. You know you find sutural joints in your skull. Basically, when there is a suture, the two bones ossify in membrane. The two bones have minimal tissue in between. It's not like they are far apart. They are very close together with little bit of sutural ligament in between. The bones lie in close position, obviously. They are immobile joints. You can't have your bits of your skull moving separately, isn't it? Right. Now, observe this image. Can you see that between the two articulating bones, the articulating edges are osteogenic layer? That means they are capable of bone formation. One day, the fibrous tissue here is going to disappear and the two bones are going to come and fuse by process called synostosis. What is it called? Synostosis. Right. So, let's talk about types of sutures. Isme bhi types hai. Okay. Depending upon the modification of the two articulating surfaces, we call sutures as plain, serrate, denticulate, squamous and wedge in groove. Plain, simple. Two articulating bones have no modification. You can see the example here to understand. The intermaxillary suture, the two bones just come and meet. That's it. This is called as a plain suture. When the articulating bones are like the edges of a saw, okay, and they fit into each other like that, you call it a serrate suture. Do this, everybody do it. Which suture? Coronal. This one, which suture? Sagittal. So, the two examples of serrate are coronal and sagittal sutures. Right. We come to the next suture where each edge of the articulating bone is like the tooth. And these tooth-like edges fit into each other, forming what is called as a denticulate suture. Example, lambdoid suture. Squamous. Do you know what's squama? Squama means scales. Fishes have scales which overlap each other. Okay, take a look at this. Can you see the kind of scale she has? Each scale is overlapping the other. This kind of joint is called as a squamous joint. In between those scales will be the sutural ligament. Example is parietal bone and squamous part of temporal bone. Joint formed between the parietal bone and the squamous part of temporal bone is typically a squamous joint. Finally, let's come to Schindylesis. Again, a word you will have to remember. Schindylesis, the wedge of one bone fits into the groove of the other. The wedge of one bone fits into the groove of the other is called as wedge and groove kind of joint. For example, the wedge of the rostrum of sphenoid fits into the vomer bone. Okay. So thus we have covered sutures, plain suture, serrate suture, denticulate suture, squamous suture and wedge and groove. Let's now come to the next category, syndesmosis. We know there will be two bones joined by sutural ligament. Okay, in this case the bones are some distance apart. The tissue in between continues to be fibrous. That's why we call it fibrous joint. But they are little distance apart. They are joined together by what is called as the interosseous membrane. Does it strike a bell? Does it ring a bell there? Yes, interosseous membrane in your arm, interosseous membrane in your leg, isn't it? So these are, here you are seeing the two bones and here you are seeing the interosseous ligament in between. Examples are middle radio-ulnar, inferior radio-tibiofibular. Two more which you are probably unaware of is posterior sacroiliac and ligamentum flava between spines of vertebrae. So these are all examples of syndesmosis. Let's go to the next variety, Gomphosis, peg and socket. There is a peg which fits into a socket. There is a peg that fits into a socket. Who is the peg? Obviously your tooth. Who is the socket? Your alveolar margin. So it consists of a peg fitting into a socket held together by periodontal ligament. They don't allow any movement. Can you imagine your teeth moving around in your alveolar socket? Try eating with those moving teeth. Okay, it will be a challenge by itself, isn't it? Think about it. Right. What is periodontitis? Inflammation of such joints. Right. So what have we covered? We've covered the basic functional classification, synarthrosis, amphiarthrosis, diarthrosis. Then we talked about classification based on structure or tissue between the two bones, fibrous, cartilaginous and synovial. We discussed fibrous joints, subclassifying them into sutures, syndesmosis and gomphosis. We saw that under the category of sutures, there is plain, serrate, lambdoid, squamous and Schindylesis. This is what we have covered, and these are all the terms that we have realized. Amphiarthrosis, minimal movement, Schindylesis, wedge and groove. Please revise these terms. Remember, they come in MCQs. Okay. So with this is an wedge and groove type of suture, belongs to the following variety of joint, obviously Schindylesis. Right. With this, we're done with the fibrous joint, students. Just take a sip of water. Maybe if you're having coffee, have some coffee. Let's go to the next part of today's class. Ready? Okay. Before that, a little request from me. If you're enjoying this lecture, students, do please give me a like and subscribe to our channel. Allow me the pleasure of making more and more of these lectures for you. Okay? Right. So let's go on now to cartilaginous joint. When the two bones are held together by cartilage, I call it a cartilaginous joint. Right? So commonly asked question, write a note on this. 4 marker, quite a lot of marks there. These are slightly movable joints, also called as amphiarthrosis. Usually the articulating ends of bone are covered by hyaline cartilage, and sometimes there may be a fibrocartilage also in between. Bones are held together on the outside by a fibrous capsule. Can you see that there is a capsule there? Right. So cartilaginous joints we know are held together by cartilage. There are primary cartilaginous, there are secondary cartilaginous. Let's see how you will understand this. Oh, The same old diagram again, isn't it? I have a primary center of ossification here, I have a secondary center of ossification here, and I have a cartilage in between. So one bone, another bone with cartilage in between. Shall I call it a joint? Of course it's a joint. If there are two bones with cartilage in between, it is a cartilaginous joint. But this one is called as a primary cartilaginous joint. Why? Let's understand why. Because the two articulating bones are covered by hyaline cartilage. They are immovable. They are joints which are temporary, created for purpose of growth. You remember this diagram was used to understand growing bone. So these cartilages are created for purpose of growth. They are obliterated. One fine day the primary center meets with the secondary center and they unite and the cartilage disappears. So from cartilaginous joint there is formation of a bone. Right. So let's go to examples of primary cartilaginous. The biggest example we've already done, which is the growing bone. So in a growing bone, you have primary center, secondary center, and the cartilage in between, which is an example of primary cartilaginous joint. This cartilage is also referred to as the growth plate. Take a look at this X-ray. Can you see the epiphysis, the diaphysis, and here you can see the hyaline cartilage indicating the primary cartilaginous joint. One fine day they're going to fuse and one bone will be formed. What happens if the growth plate is damaged? Yes, there will be malunion. Diaphysis, which would have normally fused with the epiphysis, now there may be malunion. It may fuse at an angle. It may not. It may fuse too early. All this happens when the growth plate is damaged. Right. What are the functions of primary cartilaginous joints? Common sense. The biggest function is growth. It allows for growth by holding together the primary and the secondary centers of ossification. They do give a little bit of flexibility, okay, and they resist torsion, shear, compression forces. A little bit of these forces are resisted by primary cartilaginous joints. Also come as a short note or a 2 marker for you. Let's go ahead with some more examples. One example is between the basi-occiput and the basi-sphenoid. Base of sphenoid meets with base of occiput as seen here, and there is formation of a single bone at age of 25 years. Till then your brain is growing. Can you imagine if they fused together early? Your brain wouldn't be what a magnificent large brain you have. You wouldn't have that. Right. Another example is your first chondrosternal, joint between your first rib and the sternum, or the joint between the costochondral, between all the ribs and their costal cartilages, or xiphisternal, between the xiphoid and the sternum. All these are primary cartilaginous joints. What does it mean? It means they're all going to one fine day get converted into a single bone. Right. So with this we come to secondary cartilaginous joints. What is the difference? Let's understand. Articular surface is covered by hyaline cartilage but also separated by fibrocartilage. So two types of cartilages are involved and on the outside held together by a capsule. Do this once again. Articular surface covered by hyaline cartilage, separated in the middle by fibrocartilage, held together by a capsule. These are permanent joints. There is little bit of movement depending upon the thickness of the fibrocartilage in between. They are all midline joints. They are all found in the midline of the body. And examples. I am sure you know the examples. Which is the most commonly asked secondary cartilaginous joint? Obviously, symphysis, pubis. Any other you can think of? Intervertebral disc, or joint between the two vertebrae. Manubrium sterni, the joint at manubriosternal joint found between manubrium and sternum, is also a secondary cartilaginous joint. Okay. However, this joint does show an exception in that it shows synostosis at age of 60 years. Right. So we've done quite a bit. Let's compare primary and secondary to finally put it permanently in our brain. Primary cartilaginous joints united by hyaline. Secondary also united by hyaline but also by a disc in between. fibrocartilage. Very good. Primary are immovable, secondary shows some movement. Primary are temporary, secondary are permanent. Very good. Secondary are also midline joints. Let's go to examples of primary. The most important example, growing long bone. Any other you can think of? Basiocciput, basisphenoid. First chondrosternal, all costochondral, and xiphisternal. Secondary, symphysis pubis. Yes, any other? Manubrial sterni, all the intervertebral joints. So, involving the intervertebral disc. So, with this, we come to the end of today's class, fibrous and cartilaginous joints. These are some of the terms that you will need to know. Synostosis, fusion of bone, Schindylesis, Syndesmosis, all these sins are extremely irritating. Okay, but you have to know them. I'm not going to read this. I'm sure you can pause the video and solve this MCQ. Students, again, if you enjoyed this lecture, do please give me a like, subscribe to the channel. Okay, share your comments in the comment section so that I will know what is working and what is not working for you. A lecture related to typical synovial joint and types of synovial joints there are 2 such lectures have been separately uploaded. The link for these is given in the description section. Do please see those, otherwise you will have incomplete knowledge about classification of joints of the body. So we've done fibrous and cartilaginous today. You need to do typical synovial and you need to do types of synovial joints to complete your knowledge on this topic. Thank you, students. As usual, it was a pleasure for me to have taken this class for you. See you across the screen in some other video.